For the next 60 minutes, I, Dr. Fanny Jean, a medical doctor and traditional medicine practitioner, will present to you the Life Cycle Strategic Plan (LCSP) of loprox shampoo cyclopioxolamine 1%, a dynamic plan that encompasses many disciplines to ensure the medicine's successful drug discovery, development, and commercialization of loprox shampoo. The presentation will go over the following points. 1. Market assessment for unmet medical need. 2. Product description. 3. Preclinical animal pharmacology. 4. Clinical development strategy. 5. Regulatory strategy. 6. Intellectual property, including patents and freedom to operate. 7. Manufacturing, marketing, commercialization strategy. 8. Timeline, sales strategy. 9. Final remarks and the sources. Market assessment for medical need. Number 1. Cyclopioxolamine is known by many brand names: loprox shampoo, Penlac, nail lacquer, Batrafin, and by the generic name Cyclopiox topical. Its chemical name is 6-cyclohexyl 1-hydroxy 4-methyl 2-H-pyridinone with the empirical formula C12H17NO2 and a molecular weight of 207.27. The CAS registry number is 29342-05-0. The chemical structure is represented as such: 2 benzene ring with the cyclohexyl hydroxy methyl and pyridinone group. Of the brand name precited, the one of interest is loprox shampoo by Medicis. It is indicated for the treatment of seborrheic dermatitis, a common chronic skin condition affecting approximately 8 million Americans. Skin lesions caused by seborrheic dermatitis are typically located in areas abundant with sebum-producing glands such as scalp, face, and upper trunk. Seborrheic dermatitis of the scalp is a common fungal infection characterized by inflammation, itching, and greasy scaling, as shown in figure number 2. This condition affects about 3% of the general USA population and can worsen if left untreated. Product design. According to Medicis, loprox shampoo is an effective delivery system to treat seborrheic dermatitis of the scalp. Cyclopiox is a hydroxypyridinone antifungal agent intended for topical dermatologic use only, although the relevance of this property for the indication of seborrheic dermatitis is not known. Cyclopioxolamine loprox shampoo 1% is a white to slightly yellowish white to colorless crystalline powder. It is soluble in chloroform, dichloromethane, alcohol, ether, and lightly soluble in water. It has a pKa of 7.2. Cyclopiox is a synthetic broad-spectrum antifungal agent. The proposed mechanism of action of cyclopiox-free acid and olamine salt is the inhibition of the growth of fungal pathogens, including Pittosporum ovale, the suspected causative agent in seborrheic dermatitis. It acts by chelation of polyvalent cations Fe3+ or Al3+, resulting in the inhibition of the metal-dependent enzymes that are responsible for the degradation of peroxides within the fungal cells. The non-clinical toxicology tests carcinogenesis, mutagenesis, and impairment of fertility were all negative. A 104-week dermal carcinogenicity study conducted in mice with cyclopiox cream applied at doses of up to 1.93%, that is 100 mg per kilogram per day, or 300 mg per meter square per day, showed no increase in drug-related neoplasm when compared to control. Toxicity studies. There have been a number of toxicity studies done on loprox shampoo by Medicis. The in vitro genotoxicity carcinogenicity test on the evaluation of gene mutation conducted in the AIM, Salmonella, and E. coli assays were negative. Chromosome aberration assays in V79 of Chinese hamster lung fibroblast cells with and without metabolic activation were positive. Chromosome aberration assays in V79 Chinese hamster lung fibroblast cells in the presence of supplemental Fe3 plus with and without metabolic activation were negative. Gene mutation assays in the HPRT test with V79 Chinese hamster lung fibroblast cells were negative, as well as the unscheduled DNA synthesis assay in A549 human cells was negative. An in vitro cell transformation assay in BARB-C3T3 cells was negative for cell transformation. In an in vivo Chinese hamster bone marrow cytogenic assays, cyclopyrox was negative for chromosome aberration at dosage of 5,000 mg per kilogram body weight. And finally, a combined oral fertility and embryo-fetal development study was conducted in rats with no effect on fertility or reproductive performance was noted at the highest dose tested of 3.85 mg per kilogram per day cyclopyrox. That is approximately 1.3 times the maximum recommended human dose based on body surface area comparisons. The table below presents a summary of the toxicity studies mentioned above. Product description continued. Loprox is a shampoo containing 1% cyclopyroxolamine. Each gram, the equivalent of 0.96 milliliter of loprox shampoo, contains 10 mg of cyclopyroxolamine in a colorless and translucent shampoo base, as indicated in Table 2 and Figure number 3. Loprox shampoo is intended for topical use only and is not for ophthalmic, oral, or intravaginal use. Direction for use is as follows. Wet hair and apply approximately 1 teaspoon 5 milliliters of loprox shampoo to the scalp. Up to 2 teaspoons 10 milliliters may be used for long hair. Lather and leave on hair and scalp for 3 minutes. A timer may be used. Avoid contact with eyes. Rinse off. Treatment should be repeated twice per week for 4 weeks with a minimum of 3 days between applications. If a patient with seborrheic dermatitis shows no clinical improvement after 4 weeks of treatment with loprox shampoo, the diagnosis should be reviewed. Early stage development in humans. In phase 1 study done in Germany, patients with seborrheic dermatitis of the scalp applied 5 milliliters of cyclopyrox shampoo 1% twice weekly for 4 weeks, with an exposure time of 3 minutes per application, resulted in detectable serum concentration of cyclopyrox in 6 out of 18 patients. The serum concentration measured throughout dosing interval on days 1 and 29 range from 10.3 nanogram per milliliter to 13.2 nanogram per milliliter. The total urinary excretion of cyclopyrox was less than 0.5% of the administered dose. A small percentage of people experience side effects such as rash or other discomfort around the scalp. In phase 2 studies of 2 randomized double-blind clinical trials, subjects 16 years and older with seborrheic dermatitis of the scalp applied 5 milliliter loprox shampoo 1% or its vehicle for 3 minutes twice a week for 4 weeks. Subjects who were immunocompromised, those with psoriasis or atopic dermatitis, women of childbearing potential not using adequate contraception, and pregnant or lactating women were excluded from the clinical trials. Overall status. An evaluation of the overall status of the seborrheic dermatitis based on the presence and severity of erythema or inflammation and scaling was made at week 4 using a scale of 0 equal none, 1 equals slight, 2 equal mild, 3 equal moderate, 4 equal pronounced, and 5 equals severe. Effective treatment was defined as achieving a score of 0 simultaneously for the status of seborrheic dermatitis, erythema or inflammation, and scaling at week 4, or a score of 1 if the baseline was greater than or equal to 3 for similar markers. Results. Cyclopure shampoo was shown to be statistically significantly more effective than the vehicle in both trials. Efficacy results for the two trials are presented in Table 1 below. Effectivity of 58 versus 21 of cyclopirox to the vehicle in Trial 1, and effectivity of 26 for cyclopirox versus 13 for the vehicle in trial number 2, expressed by figure number 3 of the smiling happy female face brushing her hair. It was also showed that cyclopirox is fungicidal in vitro against Malassezia furfur, Pityrosporum spp, P. ovale, and P. orbiculare. Clinical development strategy. In the late clinical development, that is phase 3 clinical studies analysis, in 626 subjects treated with loprox shampoo twice weekly in the 2 pivotal clinical trials, the most frequent adverse events were increased itching in 1% of subjects and application site reactions such as burning, erythema, and itching also in 1% of subjects. Efficacy for African American subjects was not demonstrated, although only 53 American subjects were enrolled in the pivotal trials. There are no adequate or well-controlled studies in pregnant women. Therefore, loprox shampoo should be used during pregnancy only if the potential benefit justifies the potential risk for the fetus. Oral embryo-fetal development studies were conducted in mice, rats, rabbits, and monkeys. Cyclopyroxolamine was orally administered during the period of organogenesis with no maternal toxicity. Embryotoxicity or teratogenicity were noted at the highest doses of 77, 125, 80, and 38.5 milligram per kilogram per day of cyclopyrox in mice, rats, rabbits, and monkeys, respectively. That is approximately 13, 42, 54, and 26 times the maximum recommended human dose based on body surface area comparison, respectively. Dermal embryo-fetal developmental studies were conducted in rats and rabbits with cyclopyroxolamine dissolved in PEG 400. Cyclopyroxolamine was topically administered during the period of organogenesis. No maternal toxicity, embryotoxicity, or teratogenicity were noted at the highest dose of 92 mg per kilogram per day and 77 mg per kilogram per day of cyclopyrox in rats, rabbits, respectively. That is approximately 31 and 54 times the maximum recommended human dose based on body surface area comparisons, respectively. It is not known whether this drug is excreted in human milk, but because many drugs are excreted in human milk, caution should be exercised when loprox shampoo is administered to a nursing woman. There have been no clinical trials conducting in subjects younger than 17 years old. pharmacokinetics and pharmacodynamics of loprox shampoo cyclopyroxolamine 1%. In clinical trials, the safety and tolerability of loprox shampoo in the population 65 years and older was comparable to that of younger subjects. Results of the efficacy analysis in those subjects 65 years and older showed effectiveness in 25 of 85, that is 29% of the subject treated with loprox shampoo. And in 15 out of 61, that is 25% subject treated with the vehicle. Due to the small size sample, a statistical significant difference was not demonstrated. Other reported clinical experience has not identified differences in the responses between the elderly and younger subjects, but greater sensitivity to adverse effects in some older individuals cannot be ruled out. The NDA for loprox shampoo 1% cyclopyroxolamine is 21-159. The package insert indicates the concentration, the brand and chemical names, the chemical structure, the formulation, the dosage, the mode of application, as well as the cautions in using the drug and measures to be taken in case of adverse effects. See figures number 4 and 5. It is specified that the drug is approved for topical use, shampoo for the high sebum secreting region, scalp, face, upper trunk, with similar indication for all major markets. Its final indication is that loprox shampoo is indicated for the topical treatment of seborrheic dermatitis of the scalp in adults. Common side effects are itching, mouth burning, or redness. Loprox shampoo contains 1% cyclopyroxolamine. Each gram, an equivalent of 0.96 milliliters of loprox shampoo, contains 10 milligrams of cyclopyrox in a colorless and translucent shampoo base supplied in 120 milliliter plastic bottles. NDC numbers 99207-010-10. And the unused portion after the initial treatment duration should be discarded. Loprox shampoo is stored between 15 degrees centigrade and 30 degrees centigrade, that is 59 degrees Fahrenheit and 86 degrees Fahrenheit. Dosing schedule. Loprox shampoo is not for ophthalmic, oral, or intravaginal use. Wet hair and apply approximately 1 teaspoon, that is 5 milliliters of loprox shampoo to the scalp. Up to 2 teaspoons, 10 milliliters, may be used for longer hair. Lather and leave on hair and scalp for 3 minutes. One may use a timer. Avoid contact with the eyes. Rinse off after the 3 minutes. Treatment should be repeated twice per week for 4 weeks, with a minimum of 3 days between applications. If a patient with seborrheic dermatitis shows no clinical improvement after 4 weeks of treatment with loprox shampoo, the diagnosis should be reviewed. The population target is 16 years old and up, and the medication should be kept out of reach of children. Patients should be instructed to use loprox shampoo as directed by the physician. Avoid contact, and if contact with eyes occurs, to rinse thoroughly with water. Loprox shampoo is for external use on the scalp only. It should not be swallowed. Loprox shampoo is indicated for seborrheic dermatitis for the full treatment time, even though symptoms may have improved. Notify the physician if there is no improvement after 4 weeks. Inform the physician if the area of application shows signs of increased irritation such as redness, itching, burning, blistering, swelling, or oozing. Cyclopyrox is an antifungal medication that prevents fungus from growing. Cyclopyrox Topical cream and lotion formulation are used to treat skin infections such as athlete's foot, jock itch, ringworm, and yeast infection. Cyclopure shampoo is to be used to treat seborrheic dermatitis, that is the inflammatory skin condition of the scalp. Cyclopurex topical nail lacquer is used to treat fungal infection of the toenails and fingernails. Cyclopurex topical may also be used for purposes other than those listed in this medication guide. Serious side effects of cyclopurex topical use are not expected to occur. Stop using cyclopurex topical and contact your doctor if you experience unusual or severe itching, redness, burning, dryness, irritation of the skin, or discoloration other than changes in the nails. Stop using cyclopurex topical and contact your doctor if you experience unusual or severe itching, redness, burning, dryness, or irritation of the skin, or discoloration of the hair, or other changes in the nails. Mild burning, itching, or redness may occur with the use of cyclopurex shampoo. Side effects other than those listed here may also occur. Talk to your doctor about any side effect that seems unusual or that is especially bothersome, or you may report to the FDA at 1-800-FDA-1088. Avoid getting cyclopurex topical in the eyes, nose, or mouth. Do not use bandages or dressing that do not allow air circulating, occlusive dressings, on area treated with cyclopurex cream or lotion unless otherwise directed by your doctor. Wear loose-fitting clothing, preferably cotton. Use cyclopurex topical nail lacquer on nails and immediately surrounding skin only. Cyclopurex topical nail lacquer is flammable. It should be kept away from heat and flame. Use cyclopurex topical for the full amount of time prescribed by a doctor. Your symptoms may improve before the infection is completely healed. However, it is important to use cyclopurex topical for the full amount of time prescribed by a doctor. Your symptoms may improve before the infection is completely healed. However, it is important to use the medication for the full amount of time. Do not use cyclopurex topical if you had an allergic reaction to it in the past. Before using cyclopurex topical, tell your doctor if you have diabetes, are immunosuppressed, that is, for example, have received an organ transplant or have AIDS, take medication to control epilepsy or another seizure disorder, use a topical corticosteroid on a regular basis, or use a steroid inhaler on a regular basis. You may not be able to use cyclopurex topical nail lacquer, or you may require a dosage adjustment or special monitoring during your treatment. Cyclopurex topical is in the FDA pregnancy category B. This means that it is not expected to be harmful to unborn babies. Do not use cyclopurex topical without first talking to your doctor if you are pregnant or could become pregnant during treatment. It is not known whether cyclopurex passes into breast milk. Do not use cyclopurex topical without first talking to your doctor if you are breastfeeding. Intellectual property strategy. The table below showed the summary of multiple labeling and package revisions with subsequent submission by Medicis based on FDA recommendation from 1982 to 2013 in order to protect their intellectual property. Slide 17. There have been numerous FDA recommendations followed through by the drug company. These biomarkers filled as a companion reinforce the patent. There have been numerous FDA recommendations followed through by the drug company Medicis for loprox shampoo. Medicis uses different biomarkers to reinforced as slide 17. There have been numerous FDA recommendations followed through by the drug company Medicis for loprox shampoo. Medicis use different biomarkers field as a companion to reinforce patent, such as dandruff, itchy flaky scalp, seborrhea, etc. Medicis Pharmaceutical, according to Reuters, paid $9.8 million to settle allegations that it promotes its antifungal cream loprox for unapproved uses, according to the Department of Justice. The drug company had allegedly promoted loprox, typically used for fungal skin conditions such as athlete's foot, among pediatricians as a treatment for diaper rash from November 2001 to April 2004. Loprox is only approved in the US by the Food and Drug Administration as a fungicide for patients over 10 years of age, according to the Justice Department. In order to protect their assets, Medicis entered into a corporate integrity agreement with the Department of Health and Human Services in an effort to show that it was reinforcing regulatory compliance in the sale and promotion of its product. Medicis went generic and extended the loprox product to include cream, lotion, gel, suspension of 0.77 strength, as well as its loprox shampoo 1%, and have a diverse use to include most dermatologic conditions. At time of launch of loprox shampoo 1% cyclopyroxolamine, Medicis had exclusivity of market until 2004, which was much different than when the IND was filed. At this point, loprox shampoo has gone generic with cyclopyrox topical, and many manufacturers such as Fujairah Farms in 2004, G&W Labs Incorporated in 2010, Glenmark Farms in 2009, Perrigo in 2006, Tower in 2005, all have cyclopyrox cream and topical in similar strength of 0.77%. Despite all this product with similar concentration of cyclopyroxolamine, Medicis with the loprox shampoo has maintained to be the #1 prescribed antifungal medication for dermatologic and seborrheic dermatitis. Because Medicis Pharmaceutical focuses on the development and marketing of products for the treatment of dermatological, aesthetic, and pediatric conditions in the US. It has branded prescription products in a number of therapeutic categories, including acne, fungal infections, psoriasis, rosacea, seborrheic dermatitis, and skin structures infection. The company is involved in developing and marketing dermatological and aesthetic products. Its current products are divided between the dermatological and non-dermatological fields. In the dermatological field, it offers products such as Danacin, Flexion, Solidin, Triaz, and Zyna for the treatment of acne and acne-related dermatological conditions. So, Medicis with the loprox shampoo has many opportunities with the control of the market and exclusivity. And beside, as for his strength, he keeps on improving the loprox shampoo and also broaden the area of application. The 4 P's and the 4 C's of the product. Loprox shampoo is at the drugstore, local drugstore, department store, pharmacy. You could get it online, and any local place that they take on prescription. So it's readily available where you may need it. It has a high efficacy. It's very affordable, no more than $35 for a 120 milliliter bottle. And it provides many incentives to the patients, as in coupons, savings, and the customers gave cash rebates up to and discounts up to 51 to 57%. For its consumers, such as physician practitioners, he gives incentives and he has a staff that regularly calls on them, building a trust and confidence relationship. He offers them market share, low cost to consumers, it's convenient, he has multiple warehouse locations throughout the US, and he believes on communication right at one's doorsteps. Drug value proposition. Medicis' position statement and recommendation provide relevant database on scientific evidence and success trials. The proven fact that daily use of antifungal shampoo such as ketoconazole or cyclopirox may be beneficial in treating and preventing seborrheic dermatitis, and that prophylactic measures and swift management of common skin infection are integral to preventing the spread of infectious agents, including Tinea pedis, Tinea cruris, Tinea versicolor, Tinea corporis, cutaneous candidiasis. Pricing and reimbursement strategy is fast and easy engine to conduct business. For Medicis, the price is right and let's make it. Medicis provide tuition reimbursement, pricing, travel, financial operation, and highly competitive for his customers. Medicis has extended the loprox shampoo line with 4 novel formulations of 0.77% cyclopyroxolamine each: loprox cream, loprox gel, loprox suspension, loprox shampoo. The loprox line has more than doubled the sales volume for Medicis, with novel indications in Tinea pedis, Tinea cruris, Tinea versicolor, corporis, cutaneous candidiasis, Atlas foot, beside seborrheic dermatitis, and many other dermatology conditions. The shampoo, the loprox shampoo, is also used in dilute concentration to wash areas of the body before applying the cream, gel, or lotion of different concentration of loprox. The following adverse reactions have been identified during post-approval use of loprox shampoo: hair discoloration and abnormal hair texture, alopecia, irritation, and rash. Because these events are reported voluntarily from a population of uncertain size, it is not possible to reliably estimate their frequency or establish a causal relationship to the drug exposure. On March 2003, Medicis received the approval of its new drug application from the FDA to market loprox shampoo cyclopyrox 1% at Scottsdale, Arizona. Loprox shampoo is the first and only prescription antifungal shampoo approved in the United States for the treatment of seborrheic dermatitis of the scalp, a common fungal infection. Loprox shampoo will have market exclusivity for a 3-year period and is subject of a pending patent application which, if granted, could extend product exclusivity significantly. This is to say that its market volume is phenomenal. FDA approval of loprox shampoo obligates Medicis to pay Aventis $5 million, representing the company's last financial obligation to Aventis under terms of the loprox transaction announced in fiscal year 1999. Loprox shampoo formulation is the most recent innovation of the loprox family of antifungal projects. The brand is the #1 prescribed topical antifungal therapy in the specialties of dermatology and podiatry. There is no true competitor to loprox shampoo. Loprox shampoo is a prescription product and is available in 120 ml size, NDC 99-207-010-10. They combine a dedicated sales force by Medicis staff consists of 253 employees as of December 2011, focuses on high patient volume dermatologists and plastic surgeons. Since a relatively small number of physicians are responsible for writing a majority of dermatological prescriptions and performing facial aesthetic procedures, the size of their sales force is appropriate to reach their target physician. Therapeutic dermatology sales force consists of 156 employees who regularly call on approximately 10,000 dermatologists. Facial aesthetic sales force consists of 97 employees who regularly call on leading plastic surgeons, facial plastic surgeons, dermatologists, and dermatologic surgeons. National account managers regularly call on major drug wholesalers, managed care organizations, large retail chains, formularies, and related organizations. Loprox shampoo focuses on family practitioners, specialists, nurses, or healthcare practitioners, hospitals, primary care. In the advertisement campaigns, they show effectiveness, the affordability of the drug, and the focus on youthfulness, success, achievement. They show attractive, healthy young women, socially interacted, and they show couples in social interaction on all to promote youth and health for the product. They use different markers, concentration for dandruff, rosacea, and the likes. The addition of liposonics add another innovative technology to loprox line. The liposonic system uses advanced high-intensity focused ultrasound, and also the Salta Medical launches groundbreaking social media campaign for isolate bands, all in favor for loprox shampoo. Achieve sales volume. Medicis generates its revenue from product sales and contacts. The company's total revenue increased at a CAGR of 13% during 2002 to 2006, from 213 million to 349 million. This represents an absolute growth of 126 million during the historical period of loprox shampoo. Product sales were the largest contributor to the total revenue growth. Drug sales, and that upon generic entry into the market of loprox 1% shampoo, Medicis more than doubled the total annual prescription volume. Loprox went generic, which contributed to further increase its market capacity and broaden its covered territory. The strategy used was to have the patent in 2001 for the 1-hydroxytryptamine for the treatment of seborrheic dermatitis, and the generic target hospitals, physicians, dermatologists, and it's more readily available, and because it's generic for fungal skin condition, athlete's foot, diaper rash among the pediatrician has a big number for sales. Medicine received the approval of its new drug application in 2003 for the treatment of seborrheic dermatitis of the scalp. With market exclusivity for 3 years, financial obligation to Adventists of $5 million, Medicis with loprox shampoo cultivate a relationship of trust and confidence with high prescribing dermatologists and the leading plastic surgeon in the US. They use a variety of marketing techniques to promote their product, including sampling, journal advertising, promotional materials, specialty publication, coupons, educational interaction, and in website. They also promote facial aesthetic product to television and radio advertising. They have created an attractive incentive program for their sales force that is based upon goals in prescription growth, market share achievement, and customer service. Commercialization strategy. Loprox shampoo uses multi-type of rebates, coupon, incentive, constantly adjusting sale pricing with market, and social call to prescribers, offer rebates, travel fees, tuition reimbursement, and the likes in order to promote and retain their place as the number one prescribing drug for seborrheic dermatitis. Final remarks. Although there have been periodic disappointment and frustrations with loprox shampoo has addressed the leading dermatologic concern in the United States and abroad, seborrheic dermatitis of the scalp. Loprox has an indefinite growth potential, and medicine is consistently finding new avenues for expanding the drug scope of action. The company is highly innovative in product development, sales, marketing methodologies, and social activities, but their customer-centric model is deficient by exclusion of ethnic models. The inclusion of specificity for African American and other ethnic groups could have further made their product even more successful. The investment return, despite of litigation, is in millions of dollars. The product gained prescription volume and is now among the top 10 dermatology products in the United States by dollars. I do thank you for your attention and time.